As we heard from Dr. Anthony Fauci, Ebola is a historic disaster, and the epidemic in West Africa is far from over. Just this past week, an American medical volunteer came home to be treated for the disease just up the road at NIH, and the World Health Organization documented 99 new cases. As the outbreak and its aftermath continue to plague West Africa, I'm pleased to introduce Dr. Brian De Cruz. He is a longtime Doctors Without Borders volunteer. He spent last year in the Central African Republic, and this winter he was at Conakry in Guinea working at an Ebola center. Olga and Dr. De Cruz.
Okay, great. Well, thank you so much for being here and for coming to share your story. So tell me a little bit about where you were and when, because you have had some incredible experiences recently.
Yeah, I mean, most recently I was in Guinea, in Conakry, so the capital of Guinea during the peak of the Ebola epidemic there. Before that, I've worked mostly in Central Africa, including Central African Republic, Republic of Congo, Chad, and then I was in Syria last summer as well.
And sorry, when were you in Guinea?
From November until January.
Oh, okay. Wow. And so you're usually an ER doctor in Fairfax, Virginia?
Yes, I'm an ER doctor in a hospital at home, but I split time between the emergency department and work with Doctors Without Borders.
So Fairfax, Virginia versus Ebola epidemic in Africa.
Yeah.
So what kind of brought you to volunteer for this mission and to go over there?
I knew what the need was. I had, just through working with Doctors Without Borders, I have lots of colleagues who have been working in the epidemic before I arrived, and there are just people in desperate need of care. There's a shortage of people who are experienced in dealing with tropical disease, let alone Ebola, and working in these kind of contexts, and there's still that shortage. So when I spoke with people from Doctors Without Borders and they offered me the opportunity, I jumped at it.
And so tell me about, so up there on the screen we actually have scenes from Ebola treatment centers. And, you know, anyone who's been following the news in recent months has seen some of these on, you know, front pages of major papers. Tell me, though, on the ground, what was a typical day like for you as someone who was actually working in one of these?
So I was in a Ebola treatment center. We had about 55 beds for confirmed patients, so patients who had been positively diagnosed with the disease, and about 35 beds for people who were suspects or strong suspects. I was the supervising doctor. We had a team of about 12 doctors from Guinea. So my job was, when we really got busy, was to deliver bedside medical care as well, but also to supervise the treatment protocols and make sure everything was going the way it was supposed to. That included going into the center at least, usually twice per day, in the suits for about an hour each time to take care of patients and to get to know the patients and make sure we knew what was happening on the inside as well.
So tell me about the suits, because one thing that I had been hearing is that it was actually difficult to actually, for the doctors to do the work that they needed to do, because the suits, once you were inside of them, it was very hot.
Yeah, it's exhausting. You sweat out about 1.5 liters in an hour when you're wearing the suit. We were working in, you know, it was 80 degrees before you put the suit on, and people have told me it gets as hot as, you know, 130, 140 inside after an hour. We were only allowed to spend about an hour on the inside, because past that you're at risk for passing out and becoming a patient yourself. So it's very hard to stagger and organize the care, because you have a balance between wanting to provide as much care to patients as you can, but not putting the practitioners at risk. And at the same time, you're wearing gloves, you're wearing goggles that can fog up, you're trying to put in IV lines with sharp needles into patients. It can be very difficult to balance proper care and risk to the people providing it.
And another thing I had heard about, I don't know if you experienced this, but was that the medical community that was helping out in some of these areas had a lot of tension with the local community, and there was a lot of misunderstandings that took place. Did you ever run into something where there was a misunderstanding or someone misinterpreted your directions or advice in a way that was detrimental?
Well, there was a lot of fear. For instance, pregnant women with a fever. I mean, a woman who has bleeding and fever, that's very common, especially in places with poor access to prenatal care. When Ebola started, fever and bleeding, medical practitioners didn't want to go anywhere near these women. So you had women dying of infections that had nothing to do with Ebola, kids dying of malaria, people who just can't get routine care. I mean, even things like simple measles vaccination can't happen anymore. And we ran into that a lot. A lot of doctors wanted to send us patients to make sure that they didn't have Ebola before they would provide care for non-Ebola problems. And it's hard to say if that's appropriate or not, because in the early stages of Ebola, patients may just have a fever, and it's extremely difficult to tell without doing the test.
Right, and at the same time, there's no cure for Ebola. There are treatments and sort of things that you can do for people. What were you doing to help people as they kind of waded through the disease?
I mean, the biggest part was just supporting their nutrition and hydration, making sure they were eating and drinking. And one of the toughest parts of the disease is it takes away people's motivation. So people would arrive almost depressed. You'd say, you need to eat and drink. They'd say, I can't. And you ask, well, are you nauseated? Or are you in pain? They say, no, I just can't. For people who truly were dehydrated or vomiting or losing too much, we would put IVs in and hydrate them. Everybody got antibiotics to take care of possible infections that could make it more difficult to fight off the disease. Everybody got treatment for malaria. But the best that we did was very aggressive supportive care. And there are promising treatments in the pipeline, but there's nothing yet that's proven to make Ebola better itself by treating the virus.
And was your location one of those that I just heard kind of anecdotal reports of certain places running out of just basic things like gloves or, just the sterilization equipment and things like that? Were you ever kind of in short supply of anything?
Luckily, no. We, MSF, or Doctors Without Borders, had a great supply chain, so we were always prepared for surges in the number of patients coming. But during the surge, the biggest thing was we were concerned about running out of space. And we did everything we could to avoid turning people away at the door, because once the center becomes full, if there's not another center for 200 miles, you're literally sending people home to die and infect other people.
Right. And so, one thing that was sort of interesting for me as a media person is that Americans really got I would say they were always interested, but people got extra interested when Ebola came to the U.S.
Yeah.
And it actually came to Dallas, where I'm from.
Oh.
And my parents sent me an email being like, "Did you know there's this disease, Ebola?" And so so for Americans, I feel like it really has to hit home sometimes, at least for the average person, in order for them to really clue into this. What if you had to tell the American health community or the policymaker community, what do they need to understand about Ebola? What do we need to do in order to prevent further outbreaks like this? As we can see, they affect so many people, in the location where it starts, and they also can affect us.
Yeah, and I'd say that anybody who gets the disease, it's tragic. The cases in America are closer to us because we think of ourselves getting the disease, but the people in Guinea and Sierra Leone and Liberia suffer just as much. I think the most important thing to know is that people can survive this illness. We discharged somebody cured almost every day, and we would shake their hand skin to skin when they left the hospital. In terms of stopping the disease, it's possible, but there's more than just treatment centers. Treatment centers are for people who have the disease and hope that you can keep them separated from other people while their body hopefully fights it off. But there's other things like contact tracing. For every patient, following their close contacts for 21 days to make sure they don't develop a fever. Surveillance, communication between countries for people who are crossing borders. All of those are essential activities and just as important. People like me get the attention for putting on suits and going into the center, but it's the people who are going out into the community and teaching people about it and following and doing tracing and paperwork who accomplish just as much.
And do you have any recommendations for what we should be doing in order to keep, either this outbreak to help kind of put it to a final end, or to keep this from happening, again?
I think the biggest thing that we can do to control this is commit resources to, on the ground in the places where it's happening, and not to become complacent as the number of cases diminishes. Because even one person who has it could trigger a new outbreak. It's very important to just keep following every patient who could have it, follow their contacts, and then be primed for a possible outbreak if it pops up again.
And did you mentioned that there's, when the person would leave the facility, you would shake their hand skin to skin, and that sounds important because it kind of shows that, I trust that you are, you're clean and free,
Yeah.
Was there a lot of stigma toward the people who had actually recovered,
Some of our staff didn't even tell their friends and family where they were working. And we did have patients who we were very proud to discharge, but who were ostracized when they went back home. Even one man who was basically attacked and beaten when he returned to his community for being the person who introduced Ebola to the community. And that part of it's really hard because, even what we consider successes, these patients are cured and healthy and they go out and their lives are completely changed and, they're abandoned by families and communities. In all the places where there is Ebola, at least Doctors Without Borders is doing our best to educate people to keep this from happening.
Yeah. And one thing that I've found really interesting is that the case fatality rate, correct me if I'm wrong, is about 70% this time?
Yeah, depending on the region, yes. Yeah.
So did you, just as you were working there, did you come any closer to understanding sort of what it is that differentiates between someone who lives and someone who dies?
One of the biggest things, we tried to track what makes people more likely to survive or not. Extremes of age were bad. Really small children, elderly people had markedly increased death rates, pregnant women too. And then the other thing is just the amount of virus they have in their blood when they present. There's little we can do to change that, but it gives us some insight into treatment strategies. But at least in our group, what we tried to do was pay particular attention to those extremes of age and change what we were doing. We started, feeding children more often, appointing healthier survivors to sort of appointing them, okay, this is not your child, but this is your child, take care of them, and make sure they're eating and drinking. And we started having kids under 5 survive, and that was great.
Yeah.
Yeah.
Was there anything else that surprised you there from your any other treatments that came up that you kind of found surprisingly effective?
Even people who were able to take oral rehydration and drink lots and lots of the oral rehydration salts tended to do well. I don't know if that's because that reflected they were doing well or if it helped.
Right.
But part of what we did was just encourage people to eat and drink. You're going to die. Yesterday, 3 people walked out of here cured, and I'm hoping that I'll shake your hand in a week. It's an important. We still don't know exactly what makes these people better, but we did our best to support what we could.
Did that help people just to know that other people had recovered?
I think so. It surprised me as a practitioner. Before the outbreak, I honestly didn't know that much about it too, and I had the movie perception of Ebola, that everybody gets it and bleeds and dies, and it's not like that at all. When you walk through the center, there's people sitting around tables playing cards and listening to music and just waiting to get their blood test that proves they're cured, and there's a whole community of people who are cured and doing well and out there now in the world, working again and living normal lives. And even in the center, lots of people can survive the illness. Well.
And so, you mentioned that there are a few treatments in the pipeline now. Do you know any of those which of those seem promising to you, or have you looked at those at all?
I've read promising reports about favipiravir, which is a particular medication, but it's too early to say for sure. In the center where I was, they're now doing a trial of transfusion of spun-down blood or plasma from survivors. And I don't know the date on that too, but hopefully it'll be effective.
Yeah. Have you kept in contact with the people in the region, and what are they saying now?
Absolutely. They're starting to see a small peak again, but I talk to someone from the center every few days. It's a very close community of the folks who are still in Guinea, and it's, they're optimistic. There's fewer patients in the center. They're very happy about that. Definitely fewer than when I left, but they're very optimistic about what's going on and very excited to keep taking care of patients in the hopes that they won't have to anymore.
Right. I wanted to ask you about Syria, if it's not too big of a leap. Sure. Just the conflict has entered its 5th year, and when were you over there?
In a year and a half ago in the summertime.
Okay, and which city?
I was in the north in Jabal al-Akrad, in a sort of the mountainous region in the north.
Okay.
Yeah.
And so the medical system has entirely collapsed at this point, so that in itself is a problem. But also, I think I read an interesting interview with you about you were seeing a lot of psychological trauma and almost this PTSD on kind of a mass scale. Can you talk about what you were seeing and sort of what impact you think that will have on the country as a whole, as this, hopefully even after the war, maybe ends?
I spent only 2 months there, and I still don't know how people can go through this for years and years. There were just random bombings, there was unpredictable violence, there were constant conflict from shifting of power in the region. When we had children, we'd ask them to draw pictures for us, and they'd always draw barrel bombs and planes and guns, and that's just part of the landscape now. I mean, people are unbelievably traumatized because this was a very peaceful region with no violence for years and years, and now people are surrounded by weapons and conflict and death. People are, I can't imagine how traumatized people are years after I left with the same things going on, because even for staff like us, our expats go for 2 months, and it takes a long, long time to recover. And, you know, we always have the option of leaving, but these people are watching things spin out of control worse and worse and worse every year. Yeah, it's very, very, very difficult for people there.
If you're someone in Syria right now and you have a medical condition, what would you do to get your medication?
It may not be an option. I mean, even at the point when we were there, I mean, this was a place where pregnant women could get C-sections and patients would show up with their old CT scan reports, and even a gentleman with a kidney transplant who had run out of medications to prevent rejection. I mean, now there's just no treatment. Polio's coming back. People don't have access to vaccination again. I don't know that there is an answer. I mean, there are very courageous people who are still involved in providing medical care, and there's a network of people who are trying to provide care to everybody, you know, neutrally, regardless of what's going on, but there's very little organized and very little protection for those people. And my friends who are still there are scared.
Is it pretty safe for Doctors Without Borders there, or is it?
We left because of security issues, so there aren't expatriates working in the country anymore. You know, there is some assistance provided to people in the country, but there aren't any expats there at the moment that I know of. I mean, that may have changed recently, but none that I know of.
Yeah. I want to take it to questions. I'm sure you guys have a lot. Over there?
John Cummings, and the question just regarding re-entry there was quite the controversies with doctors coming back and medical workers coming back into the States. What's, just from a medical perspective, what's the appropriate way to go?
So I can say, I mean, obviously that's a loaded topic, and I was very cautious about my re-entry. But people who don't have a fever, who aren't sick, cannot transmit the disease to other people. I think things that close people off or keep them isolated on their return aren't necessary medically and can absolutely keep people from working. I want to go back to the field. I want to work back with Ebola again, but to spend 3 weeks, not be able to go to my family or to be monitored or to be isolated, it's a very real problem that I can understand how it keeps people from going back. I would say that forced quarantines don't make medical sense based on what we know about the disease. There's been many people in the US who have had Ebola before they were diagnosed in a hospital. None of those people have transmitted the disease to others.
We have time for one last question.
Hi. Excuse me. Hi, Mike Neeson, Evolent Health. One question that I have is, what has been done to ensure at an institutional level that the hard and soft infrastructure put in place to help combat Ebola in West Africa can be maintained and made permanent parts of the health resources ecosystem in those countries, not only for Ebola in the future or for the next big epidemic, but also for maternal health, for malaria, pneumonia, so on and so forth?
I mean, I know there's ongoing advocacy from Doctors Without Borders to ensure that from other actors. I don't know specifics of what people are setting up, but clearly that's a need. I mean, it's very clear that once Ebola is gone from each of those countries, there's going to be huge gaps that remain to catch up. And I mean, I know of advocacy, but I don't know of specific steps that are being taken right now.
All right. Well, thank you so much, Brian DeCruz, and thank you, everyone.
Thank you.